Hello, hey YouTube, how you doing?
Hello.
I'm Tiffany.
I'm Stephanie.
And together we are Tiff and Steph. Yes.
And we're talking about mental health.
I know y'all like, why are they so excited? We are excited because we are here to help you. And we're assuming you clicked on this video because you're dealing with some depression, right?
Right.
You have come to the right place, hunty.
Yes.
Have they come to the right place?
Oh, yes.
We about to help you, okay?
Yes. You're happy already, aren't you? I know.
And by the title, we got some tips. We got some
Yes.
tricks, honey. We're going to get you together.
Yes.
Yeah, we're going to get you together. But we got to start out with the definition, okay? Because we have to make sure that you even understand what depression is. Because people think they're depressed, and sometimes they're not. You know, you could be sad and not depressed, really. Not clinically depressed or have major depressive disorder. So we're going to start out with the definition first, right?
Yes.
Okay.
Right. Okay.
So depression. So for us to really diagnose you with depression, because that's what me and Stephanie do, we diagnose, we treat mental illness, okay? You kind of got to have some signs and symptoms. So you want to start off with the first sign, Steph?
Sure. First sign or symptom is like loss of interest in doing anything. I want to get out of bed. I don't like you had interest before and you used to go out and bird watching, and now it doesn't bring you joy anymore.
Bird watching?
Bird watching.
Did she say that? Okay. Maybe you used to fish, okay? Maybe you used to go line dancing. Maybe your bird watchers out there know. Okay, but you used to do stuff, you don't really do it anymore. That's a sign. That's one of the signs. You need a couple signs. And this is usually over the last couple of weeks. 2 to 3 weeks you haven't really been doing the things you like to do. That is a sign of major depressive disorder. Another sign would be
weight changes. Changes in weight.
Absolutely.
Up or down.
Up or down.
Some people stop eating, some people can't stop eating. That's a big one.
Yes, you will see an increase sometimes or decrease in your weight. That is definitely a sign of major depressive disorder. Another sign would be just fatigue. A lot of people, they're tired, very tired.
All the time.
Yeah, they'll come into the office and they'll be complaining, you know, Tiffany, I can't move. I just can't get out of bed. I'm just so tired. That's a classic sign of major depressive disorder. Suicidal thoughts.
Suicidal thoughts.
Yeah, you'll start having really depressive thoughts, suicidal thoughts, very common.
Worthlessness.
Hopelessness, absolutely. Yes. Very common signs of major depressive disorder. I'm trying to think, anything else? Concentration, lack of concentration. You just cannot focus to save your life. You get up, you're trying to wash the dishes, you're trying to vacuum, you just all over the place.
All over the place. And nothing is getting done.
Oh, did you say nothing?
Nothing is getting done. Yeah.
So we're going to help you, okay? Those are some of the common things. If that's what's happening to you, please continue to listen. We got about 20 tips. We're going to split this up in 2 videos, okay? We're going to do about 10 tips in this video, and then you'll see a part 2, and then we'll have like 10 tips, okay? So tip number 1.
Ooh, tip number 1.
Now, we know that, of course, you should go see your doctor, right? But what Steph and I both know is that people do not like going to doctors.
I don't want to go.
No.
So we figured, let's give them some stuff that they could do kind of at home to kind of get you going until you get to the doctor. Because you should go to the doctor now. You should. But we know that a lot of y'all don't go.
No.
So, a couple things you could do. Or some of you guys maybe have a doctor's appointment, and the appointment ain't for 4 weeks, and you're depressed, and you need to do something until you get to that doctor's appointment. Okay, so one of the things I recommend, how are you sleeping? Improve the sleep. You can take some liquid melatonin. You could take a walk. Exhaust yourself.
Exercise.
Sometimes you're just sitting around too much, and you're not expending enough energy.
Exercise increases dopamine in the brain, which is your happiness. That's the happy hormone. It stimulates happiness. So if you exercise, it will make you feel better.
Absolutely.
Therefore, you'll get some sleep at night. It'll make you rest.
And a lot of times when you're resting, the depression lifts due to the improvement in sleep. So if sleep is a problem, you kind of have to address that in order to address the depression. Now, in some instances, if your depression is moderate to severe, you definitely need to see a provider because it's going to be hard to improve this sleep by yourself. But if it's more of a mild depression, and you could get some liquid melatonin or take some melatonin and definitely try to improve that sleep.
Absolutely.
Counseling
works.
Psychotherapy, get with a counselor.
Yes.
You know, make an appointment. There are a lot of good counselors out here. Reach out to one, maybe phone a friend, ask a friend. If she knows a good counselor you can see that you could just go have a conversation with. Talk therapy works.
Support system, having a support system works.
Absolutely.
I mean, you can just talk to someone about it. It makes you feel better. You got up from your chest. A lot of it is situational. That means it's not going to be forever. It's just the situation that you're in and you're going through at that time, and it'll go away. But some of it is clinically, you need to see someone like us so we can help take care of that. But we often start at the basis, what we're talking about now, these signs now, little things you could do. You know, like you come to us, we'll even check your vitamin D level.
Right, vitamin D.
Because no sun, you're not getting enough sun.
Yeah, vitamin D is another big culprit of depression. So when you do get in to see your doctor, have them check your vitamin D level. Because a lot of times the low vitamin D is a culprit to depression.
Oh my goodness.
Oh, the vitamin D's be in the gutter.
Woo! So low.
Especially if you're in the Midwest. You live in the Midwest or where you're not getting a lot of sun. Oh my God, I've seen some really low vitamin D's. And you correct the vitamin D and boom, the depression is really so much better.
Yes.
So definitely if you could get in with your primary care doctor and have them check your vitamin D level and then make that correction, you could really be feeling a whole lot better. Also the thyroid.
Oh yeah.
Oh, while you in there, have them check your thyroid because the thyroid, if it is not accurate, if it's not within normal range, it can look like you are crazy.
Yes,
and you're
absolute nuts. And you're not crazy.
No,
not at all. It can look like it though.
It can look like it, and you'll think you're crazy.
You'll think you're crazy. You'll feel crazy,
and you're not.
You're not crazy.
You have a hypothyroid problem, okay, or hyper.
As soon as that is corrected, easily corrected. You're like, oh, I feel wonderful.
I feel wonderful. The depression goes away. I just had a lady like that.
Did you?
Yeah, her thyroid was out of whack. I put her on levothyroxine, and within a couple months, once she started, her levels started improving, the depression went away. So definitely vitamin D, have your vitamin D checked, and definitely have your thyroid checked.
Yes. Did we talk about the happy lamp?
Oh, the happy lamp. That's probably
we got to throw in the happy lamp.
The happy lamp, yes, the happy lamp you can get on Amazon.
Yes.
Is it called
the
happy
lamp?
It is a happy lamp.
It's a happy lamp.
You go on Amazon and you can order one.
Yes. It's light. Makes you feel happy.
It does.
And it works.
It works.
I have had several patients get the happy lamp and they actually feel better.
I had a patient bring the happy lamp into my office. I did. I was like, let me see this happy. Do it really work? The happy lamp don't work, right? I know what y'all thinking. They like, what happy lamp? You know what they think.
No, really. Truly.
Try it. Some insurances pay for it.
Yes.
I had an insurance company pay for the happy lamp. Or you can buy it off of Amazon. You gotta check with your insurance company, DME supply company, your insurance. But you use it for about 30 minutes a day. People use it at the beginning of the day. And it does make you feel a little bit better.
It does.
Yeah, that was interesting. I really like the happy lamp.
One more thing. If you're depressed, don't turn to alcohol or drugs. It just makes it worse.
It does.
You sink lower, and then you add another problem to your depression.
Absolutely.
Don't go there. It makes things worse.
It doesn't fix it. And I'm sure you guys already know that.
Of course you do.
That's why you didn't click here. I'm sure you didn't try drugs and alcohol already by now.
Because when you sober up, hey, still. What did I say that? I'm sorry.
We still working on ourselves, okay? You know, don't judge us. Don't judge. We still working on us too. Okay. Another thing, I think we're on probably number 10. Yeah, we're getting to like number 10.
Yeah.
We're gonna try to keep count in the next video. We new at this, y'all.
Yeah.
Bear with us. We have good content.
Good content. We're going to help you and make you feel better each and every video.
We are.
Stay tuned.
Please.
A lot more to come.
But we have never done this before.
No. And please leave your questions, comments at the bottom.
Yes.
Things you want us to talk about. Things you would like to ask us. We will answer those.
Yes.
We will talk about what you would like to talk about. Please
Yes.
leave those things. We're so excited and so happy to just extend, because we have a very good success rate with our patients, and we just want to extend more help out to everywhere that we possibly can.
Yes, yes. And so hopefully these videos will help you guys.
Yes.
We're gonna give you some more tips and tricks in the part 2. One last tip I'll ask you guys to do is evaluate your environment. Are there people that are impacting your happiness?
Yes.
A lot of times when my patients come in, I'm able to identify that there are stressors, there are people, mostly friends and family, that are impacting your mood. And so we'll dig deeper into that, but the first step is acknowledging it. At least going, okay, yeah, this person does not make me feel happy. We'll dig deeper. Don't shoot the messengers here, okay? Oh, Lord. We're still in the process of working on ourselves. We're working on
They don't make you happy, smile?
Don't do
Kick
that.
them to the curb.
Hold on, before you kill them. We're going to still, oh, Lord, help us.
Just move them out easily.
In the next video, y'all, we're going to be right here helping you guys deal with this depression and get you feeling better. We got some more tips coming in the next video. That was pretty good.
Yay. Hey, thanks for watching. Bye.
Thanks for watching.